At the conclusion of the presentation, we will address as many of your questions as time permits. We will also be conducting one poll in a few minutes and appreciate your participation. When you see a poll pop up on your screen, please enter your responses. Also, today's webinar, the poll has popped up. So today's webinar is going to be recorded, and the link to view the recording on PRA's YouTube channel will be emailed to all registrants following the event. You can enable closed captioning for today's event. To view captioning, click the captions icon and then select show subtitles. So before we get started, we wanted to see where everyone's joining here from today. And so that's the poll that has popped up on your screen. It looks like we have some representation from many, many states across the country. A fair contingency from Tennessee, welcome. And particularly with the storm brewing right now, glad you all able to make it. And also from Nebraska and California. So we thank you all for coming from all across the country today to our webinar. A quick look at the agenda. We'll start with an introduction to the Court Navigator project by Dr. Sarah Demaray. Next, we'll have a presentation of our Court Navigator programs and discussion of the project's findings led by Dr. Samantha Zatola, Brandon Morrissey, and Iceland Massey. Following that presentation, Dr. Zatola will moderate a panel discussion with several of the court navigators who participated in our research. After that, Michelle White from the State Justice Institute will share some concluding thoughts on Court Navigator programs. And finally, we will leave as much time as we can for a Q&A session. Now, I will turn it over to Dr. Sarah Demaray, President and CEO of PRA, and the co-PI on this project to share a brief introduction.
Hi, all. Thank you so much for being here. And special thanks to those, again, in communities being affected by the storm. So I'm going to keep my comments very short and hopefully sweet. I wanted to say a little bit about PRA. First of all, we are a women-owned small business and are a national leader in behavioral health research and technical assistance, and we've been doing this work since the 1980s. Our mission is to create positive social change for people and communities through technical assistance, research, and training. We offer core services in this area that include, as we'll be talking about today, research and evaluation services. I wanted to just sort of give that quick background on our agency to set the stage for how and why this work is so important to us and fits so squarely within our mission. So as an organization, for decades, we've been seeking strategies that reduce contact and prevent future contact, especially among those with behavioral health issues with the criminal legal system. And we really believe that there are strategies and places that these individuals may be better served. So it was through partnership and discussion and a long-time collaboration with Michelle White that we came to talk about different efforts and different projects and strategies that might really fit within PRA's mission, our scope of work, and the needs of the field. We feel very strongly that the work we're going to present to you today represents a sustainable and achievable model, and really feel like we're at the very beginning of a new type of work to prevent future system contact in this population. I don't want to share or steal any of the thunder from the findings of this work or from our other presenters, so I'll say just a few things very briefly. This was a multi-year, multi-phase project that really reflects a lot of collaboration and a lot of partnership. Our first effort was really to figure out what was happening out there in this world of court navigator programs. It felt very similar to other programs and other initiatives out there, and we were trying to sort of wrap our arms around what is this idea of court navigation and support. So we conducted a national scan that our speaker is going to talk about very briefly. We then, once we identified programs, did a survey to find out more about how they work, where they work, who their clients were, who their staff were. and then ultimately conducted in-depth site visits and interviews from a handful of sites. And we're going to be really presenting most of our findings and focusing primarily on that today. So I think this is really, I hope, kicking off a newish a strategy and approach that local communities can achieve and take up. And our hope is that what we present today will be the beginning of many conversations and continued efforts with various partners on the call and in your own communities. So I will leave it there. I will hand it over to my co-PI, Sam Zatola, to really dig into this work more. And I'm looking forward to hearing everything that you all are going to learn today, but also your questions and comments and ideas for the future.
Thank you so much, Dr. Demaray. Now we will hear from three members of the research team for this project, Dr. Samantha Zatola, Brandon Morrissey, and Iselin Massey. They will be describing the findings from the last 3 years of research with a focus on 5 specific Court Navigator programs.
Thank you so much, Alon. We are really excited to be here today with you all to share some of what we've learned over the last 3 years of work. So I want to share just some quick background to kind of set the stage and share that the idea for court navigators really comes from the recognition that courts and the legal system as a whole are incredibly complex. And many people struggle to navigate their legal involvement, and they don't have support during the process. And this lack of support can result in some unintended consequences for them, like missed court payments, unintentional noncompliance with a court order, kind of general confusion about where they're at in their process. And it can result in consequences for the court, things like having to reschedule hearings or take court personnel away from their responsibilities so that they can walk someone through a process. And this can cause slowdowns in case processing, which have a lot of downstream consequences for the courts. And all of this gets even harder for people with behavioral health needs because they face additional challenges that can really complicate their case process for both them and for the court actors that are involved in their case. And without support, people with behavioral health needs are even more likely to end up cycling through the system repeatedly and having that kind of cycling repeated contact. And courts have been doing, I think, more and more over the years to really try to address behavioral health needs. And court navigators are one of the really innovative solutions that courts are implementing because these navigators are totally focused on providing people with support, helping them navigate their legal involvement, and get connected to services in the community to address their needs. So like Sarah talked about, we completed a national scan of navigator programs to kind of develop a picture of the court navigator landscape in the US. And at the time, we found 18 navigator programs across 21 different states. And we know that a couple more programs have come into place since we finished the scan in 2023. So there are even more programs out there now. And what we learned doing this scan is that the details of each court navigator program vary widely. There are a lot of ways to implement a court navigator, and partly because the development of this role is always highly local. It's really usually county partners that come together and create a position that will meet the needs of court and justice involved people in their jurisdiction. And they really try to design this role to be something that they have the resources to support. So it's a very local process, which is a really great thing to see. After the scan, which gave us a really kind of broad understanding of court navigators, like Sarah said, our next step was to do a deeper dive of a few specific programs to really try to learn how the programs work from the perspective of navigators themselves and from the people who regularly work with the navigators. And we wanted to be able to relay this information to the public to help other jurisdictions that want to develop a court navigator position. So for our deeper dive, we visited 5 programs between November 2023 and May 2024. 4 of the visits were in person and 1 was virtual. The visits included things like tours at the courthouses, jails, resource centers where navigators are working. We visited some service providers that navigators refer people to. We also did some observations of court hearings and kind of common areas in the courthouses and some observations of navigators just kind of interacting with people going about their daily work. And then we completed interviews with 93 people who were affiliated with these 5 programs. These were also virtual and in person. And we talked to a really wide range of people. Across programs, we talked to court actors, jail actors, kind of other county actors, folks who worked in sheriff's offices, We talked to service providers, the navigators themselves, and then people who navigators had provided services to. And I want to pause here and just say a really huge thank you to the folks at each program who coordinated our site visits, because it was a lot of work, and they were all so hospitable and so generous with their time to let a group of researchers come in and ask like a million questions and follow them around for a couple of days and learn about what they were doing. And we also want to say thanks to all the folks who participated in interviews, because again, they were very generous with their time and really engaged with all of the questions that we asked. And we wouldn't be here today sharing this information with all of you without all of them. So a huge thank you to everyone that made those site visits and interviews happen. So for most of our discussion, we'll talk kind of broadly across all the programs, but I did want to just introduce the 5 programs that we visited and share a little bit about their structure, so you can get a sense of kind of some of the variety in terms of the structure and the employment strategies and the funding for these different navigator programs. So up first is the court navigator in Buncombe County. He is one navigator in the Buncombe County Courthouse. He's got a desk set up in the courthouse lobby just past the entrance, so he is highly visible as people come right into the door of the courthouse. He is employed by Goodwill, but he's in the courthouse full time. His position right now is in pilot phase. It's grant funded by the MacArthur Foundation through the Safety and Justice Challenge, with a plan to figure out how to make the position permanent. Next is the court clinician in Chesterfield County, Virginia. So you'll notice that not all these positions are called court navigators. We kind of use that term when we're just sort of speaking broadly about the role, but within jurisdictions, there are like all different labels for this position. So there's one court clinician in Chesterfield County District Court. He has an office just past the entrance of the courthouse in the same hallway as the general district court rooms. So again, he's very kind of accessible, easy to find. He's employed by Chesterfield Behavioral Health, which is a community-based behavioral health agency, but he's in the courthouse full-time. His position was originally funded by the Bureau of Justice Assistance, but is now a permanent position in the county. In Franklin County, Ohio, there is a team of 1 social work navigator and 3 court navigators that provide services in the Franklin County Municipal Court, specifically in the eviction court. So they work in the lobby and kind of main hallway outside of the courtrooms on the eviction court floor. They're all employed directly by the court. Their positions they're funded by a couple of different sources right now. It's some city and federal grants. They were using ARPA money at one point when they had that. Now they're using some emergency rental assistance funding money, but there's a proposal in to make these positions permanent. So you'll kind of see it's a theme. A lot of these positions start with grant funding, and then there's a plan to kind of figure out how to make these positions permanent. In Massachusetts, there are 15 recovery support navigators that provide services across 10 counties. Generally, there's 1 navigator in each county, though a few have multiple navigators. These navigators are located in all different kinds of courts, and some of them are located in community justice support centers, which are close to courts and provide services to court-involved populations. These navigators are also employed by behavioral health agencies, but are in the courts or the community justice centers full-time. And they are currently funded by BJA, by the Comprehensive Opioid Stimulant and Substance Abuse Program, so grant funding, with a lot of discussions about how to make the roles permanent. And then finally, in Tennessee, there are 34 criminal justice liaisons that provide services across all 95 counties in the state. So generally, there's 1 liaison assigned to a few counties, and some of the liaisons are supported by case managers in the work. These liaisons they're in a range of courthouses, and they also go into county jails and work with people on release planning. So because they're assigned to a few counties, they're not stationed in one specific location. They kind of travel around throughout the week to each of the different counties that they serve. They're employed by behavioral health agencies and are funded by the Tennessee Department of Mental Health and Substance Abuse. So that's permanent funding. This program is actually the one that's probably been around the longest. It's been around for about 25 years. So before we share some of our kind of broad descriptions of how these programs work and our takeaways across programs, I want to just briefly mention how we used the interviews that we did to get to these descriptions that we'll share today. So we transcribed all of our interviews and engaged in qualitative coding of the transcripts. And I'll really kind of oversimplify this a little bit just for the sake of time. But basically, we went through kind of an iterative process that involved reading the transcripts, flagging topics that came up frequently, looking for patterns and themes among those flagged topics, discussing them between the team, and then kind of going back to the interviews, looking for more themes. And we kind of went around and around on that a little bit until we were able to organize a clear picture of each program that is ultimately based on the experiences and perspectives of the people that we interviewed. And so there were 5 topic areas that we kind of cover for each program. We talk about kind of the overview or program design. We talk about the needs considered by the navigators, the process for involvement with the navigator, areas for growth of the program, and benefits, excuse me, of having a navigator. So for the rest of our presentation, we'll share just kind of a few highlights or summaries from each of these topic areas, and we'll share with you all some of the interview quotes that really kind of illustrate our points. So there were 2 aspects about the design of the court navigator positions that came up repeatedly across interviews as being very important to how the role works. The first was that the navigator position is intentionally incredibly flexible. Navigators' daily and weekly routines vary, and they have a lot of autonomy to set their own schedules and kind of do what they need to do throughout the week. Navigators also have a lot of flexibility, and they can really vary the strategies that they use for engaging a person in services. So they kind of have like a general process that they follow, which my colleague Brandon will talk about in a little bit. But within that process, there's a lot of leeway to really engage a person in whatever way they judge appropriate for that person, for the environment, kind of for the moment. This flexibility really allows the navigators to be responsive and adaptable to the legal system actors that they're working with, to the service providers that they're referring people to the people themselves, and to the environments that they're in. So as one kind of really concrete example of this flexibility, if a navigator shows up at a county jail to meet with a couple of people and work on release planning for the afternoon, and they get there and the jail is on lockdown, they can leave and they can go to a different jail. They can go somewhere and do some follow-up phone calls with people that they've already placed in services. They can go to a new community agency that's just open that they want to learn a little bit more about. They have a lot of agency over how they spend their time. And the flexibility also really allows navigators to engage in additional activities that can support the work that they do. So they can join committees within the court or attend meetings for relevant community groups that might support their work. As one example, one of the navigators shared that he joined a community engagement work group in the court that he works in. And this group really focuses on seeking community input and making changes to the court to address the needs or concerns of the community. So he joined this committee because as part of this committee, he's able to share what he's learning as a navigator, working with people with the committee. But then he's also able to take what he learns in the committee back to his work as a navigator. And it really kind of supports what he's doing and can help kind of shape some of his services. Another aspect of the design of court navigator positions that we learned is critical is networking. So navigators spend a ton of time building large networks across the legal system and throughout the community with service providers. Navigators use this networking as a way to spread the word about their role, to form relationships with people that they want to collaborate with, and to get referrals, both referrals to them for people that they can work with, and then to figure out who they can refer people to for services in the community. And navigators that we talked to told us that they spend a lot of time out in the community meeting with service providers, attending community events, handing out business cards. They also spend a lot of time walking around the courthouses, meeting everyone in the court, from judges to probation officers to clerks, to make sure that they're a really familiar face among the courthouse so people know to refer people to them, and so that they are really familiar with the court and know how to direct people around the court and know how to answer questions about the court. The navigators also spend a lot of time maintaining their networks. And this keeps their relationships strong and up to date. So they know when there have been changes or turnover. They know if a court actor wants to try a new process for referring someone to them. There's a lot of really regular communication between the navigators and their networks. And maintaining these networks also allows the navigators to really stay efficient in how they are connecting people to services, because they're up to date. They're not going to try to refer someone to an agency that is already closed. They're not going to be, stuck relying on a contact for someone who's left an agency. They're really keeping their network up to date, so they know kind of where things are at and kind of where agencies are. So the navigators' networks are a really huge piece of what makes them successful. So they need time built into their work weeks to kind of build and maintain these networks. And it wasn't just the navigators who talked to us about how important those networks were. We had a lot of other folks that we talked with that really articulated the value of the navigators' broad networks. So we had one court actor share with us. She was talking about the navigator that works in her court, and she said, I mean, she'll know that 10 minutes ago, some staff member left, and so there's not as many beds or staffing available. It's incredible how much she has her finger on the pulse of programs. I think it's all about relationships. So this court actor really kind of recognized and valued the navigator's role. And then we had a service provider who shared with us about a different navigator. He said, a lot of times she knows our program, she knows kind of our criteria and what we take. It makes it real easy for us. So he was explaining that the navigator never refers people to his program that aren't appropriate for the program because she's really familiar with it. She's familiar with the criteria. So he knows he can trust her referrals when they come in. And that kind of helps the referral process move along faster. So it was really flexibility and networking that were two major takeaways we had in terms of what's really important about the design of the navigator role. So I think now I'm going to hand it over to my colleague Iceland, who will talk some about our takeaways that we saw for the needs that navigators are addressing.
So these are what we observed as some common needs considered by court navigators at the sites that we visited. A common need that navigators address is helping people to navigate the courthouse and address their court-related needs. We visited a couple of courthouses that were described as confusing, and it was either because of the layout of the courthouse or because of confusion around accessing courthouse resources. Courthouse staff described relief in having the navigator role because it allows them to spend less time directing people to courtrooms and resources, such as the cashier's office or on-site social services. People also experience a lot of anxiety when they come to court, and court navigators are seen as a welcoming presence or a friendly face to people and are described as easy to approach. They're often dressed in casual clothes and appear more inviting, and this approachability in the courthouse is important because it eases the stress of people served and provides them extra support in navigating their next steps. Navigators also have tools and resources to help people on their court date, such as locating and sharing important case information that a person might not have together. Court navigators also have been known to address people's basic needs, like providing complimentary coffee or just even being an ear to listen when a person is experiencing stress. This first quote is from a person who works closely with the courts, and they describe how confusing the courthouse is when you first enter. They said, I can imagine coming in to actually have to go to court, and it's just like there's no clear way that you're supposed to go. There's the police presence and having to go through security, and then after that, it's a little bit like, what am I supposed to do? There's this big open lobby, and there's no clear signage. This next quote is from a navigator describing the ways in which they alleviate anxiety for people coming into court. Our navigation team has an office on the same floor as court. Honestly, it's also used as a diaper changing room because I'm like, look, if you need to nurse your baby, change a baby, you need some privacy, our office is available. So we really try to make it as customer-centered as possible, letting them know that they could even have a private space to talk with me in, which a lot of times can do a lot for someone's anxiety. Next are behavioral health needs. Justice-involved people often experience behavioral health needs that haven't been met in the community and while they're navigating their court processes. People may be struggling with various mental health diagnoses or substance use needs, and navigators help to get these needs addressed. Court navigators are skilled in triaging needs and connecting people to behavioral health services. They're able to provide warm handoffs, and this ensures a proper connection to services. Some provide on-site counseling and assessments and to better consider the needs of people served. Navigators consider these needs at various points in the justice process. Connecting people to behavioral health services can be a factor that helps to divert people out of the justice system. Here are some more supporting quotes. This first one is actually from a person receiving services, and they shared their lived experience to explain how navigators get people resources in the community that prevent unfortunate outcomes. It says, I think anybody struggling with addiction is a great candidate because there's a lot of people that are just dying from drug addiction, and it's sad to say so many lives have been lost. This next quote is from a navigator with social work background, and it describes different ways that they've been able to meet people's behavioral health needs. A really critical piece of having social work in the navigation program is the ability to really work with people who need a more clinical degree of support. It's pretty serious what people experience when they come to court and what they're already experiencing day to day. I've made direct referrals to mobile crisis when a tenant was psychotic and was not able to participate in their own case. I provided crisis care for someone who was imminently suicidal. Lastly, court navigators also are able to provide social service needs. Court navigators are essential to considering social service needs and can help people manage tasks and access resources at several points in the justice system process. Some navigators solely do referral-based service, while others have a more intense engagement and can act as case managers for people's administrative needs. Common needs of justice-involved people include transportation to court-related appointments, financial resources, childcare, and even obtaining birth certificates or Social Security cards. Here are a couple of quotes for social service needs. A navigator describes the common barriers people face in the reentry process, saying, "It is really intensive, people getting out, and these systems are not meant to be easy. People cannot navigate Social Security or even get set up to let these agencies know that they're out of jail. It's just all these different communications that aren't happening. And then you expect someone who's starting over from square one, or maybe is just getting used to their meds or not on meds, to navigate all of these things." This next quote is another navigator describing how they help a person create a plan of action and plan through their next steps for and helping them to manage the different tasks and things they need to get done. It says, "I do a lot of case management with people. If they're willing to come in and sit down, I have lists of jobs that are felon friendly. So I will sit with them and try to talk to them about what their plan is. What's next? Because we can't rely on grants to live. What is going to happen next, and what does that look like?" This next section, I'm handing off to my colleague, Brandon, about the process of getting engaged with Court Navigator Services.
Thank you, Iceland. So like Iceland just said, I'll be talking about the process. These programs are unique, but they generally follow a similar 3 to 4 step process. So the first step is referral to navigators. This step focuses on how a court-involved person first gets introduced to the navigator. Listed here on the slide are kind of general categories of referral sources. So several of the navigators have desks or offices in public spaces, and they report meeting clients just by people coming up with a quick question. Similarly, navigators may reach out directly to people. Several supervisors we spoke with noted that when hiring people, they were looking for someone who was willing to reach out if they noticed someone looking lost or in need of assistance. Navigators receive referrals from people in and around the courthouse, including judges, defense attorneys, prosecutors, bailiffs, probation, and jail staff. Referrals from the community can include treatment providers, law enforcement, and sometimes family members. How these referrals work varies with the program. Referrals can be formal, such as in Chesterfield, where a judge submits an official form created for the purposes of referral, or informal, such as someone stopping by the navigator's office with a quick question. After being connected to the navigator, the second step is the initial meeting. Generally, the point of this meeting is for the navigator to understand the needs of the person they're helping. Navigator usually explains their role and what sort of issues they can help with. For programs with a lighter touch, this can be a quick process. The navigator may ask, "What are you trying to find?" The person may tell them a courtroom, and the navigator can bring them to the courtroom. For programs with a higher level of engagement, this can be a more intensive conversation and include questions about their current needs, the status of their legal case, the history of behavioral health treatment, all depending on the direction of the conversation. Some navigators reported using formal screening tools for assessing risk of homelessness or risk of suicide. Additionally, navigators may collect demographic information so that they can use this information when filling out applications to programs on behalf of the person they're working with. An important step in this phase is getting releases signed by the people they're assisting so that navigators can actually act on their behalf. Now, the last point listed here was emphasized by navigators across programs. Navigators are aware that courthouses can be very intimidating places, so they kind of take steps to build rapport with the people they're helping. This comes across in how people who have received services speak about the navigators. Describing interactions with the navigator in Chesterfield, one respondent stated, "You know, I really like that guy. He seems to be looking out for me." Next slide, please. Thank you. So the navigators have done their initial meeting and have a good idea of next steps. This phase is the connection to services. As Sam described earlier, navigators work to develop an encyclopedic knowledge of service providers in their areas, both in the courthouse and in the community. After gathering information through their initial meeting, they decide on the appropriate services. For programs with a lower level of engagement, this may look like walking them to a service located in the courthouse. At higher levels of engagement, this involves working with partners in the community. Some navigators work with people receiving services to fill out applications and submit them to a curated list of providers. One person who had previously worked with the navigators in Tennessee stated, "The navigator went through and helped me fill out a couple of applications. I couldn't believe it. Housing was all lined up and ready for me." My colleague spoke earlier about one strength of the navigators being the relationships that they build. Leaning on those relationships, navigators can cut down some of the wait time in a system that relies solely on submitting applications and getting rejected or accepted. In some cases, navigators may also facilitate transportation to those services, although this is not universal. The final phase is follow-up. So not all programs conduct follow-ups. Programs with a lighter touch are designed to handle quick questions and not set up to have ongoing contact with people after the initial connection. However, some programs will meet with people several times after the initial meeting. These meetings can have different purposes. One purpose noted by navigators was to work through more complex, time-intensive needs, such as getting people connected to Social Security. Follow-ups may also be used to see if the initial service connection is working appropriately, and if it isn't, figuring out a new plan. A quote from a navigator we spoke to in Tennessee was, "We tell them to, if you get to the group home or recovery house and you absolutely hate it, don't just leave. Call us. We'll find you something else." Navigators provide contact information to people they have received help from and are encouraged to reach out again if they need additional help. Next slide, please. Thank you. So now I'm going to talk a little bit about areas for growth our respondents noted. The Court Navigator programs we focused on all spoke very highly, or were all spoken of very highly by people interviewed. But like all policy, it is constantly being tweaked to better function. Across programs, the people we spoke with noted two main areas for growth. The first is defining the scope of the role. As Sam mentioned earlier, one of the strengths of the navigator role is that it is flexible and can grow to fit the needs of the community. Potential downside is that this can result in navigators being regularly asked to take on new responsibilities. One supervisor we spoke with said the following about this concern. "Is this something you feel you can really handle? Is this within the scope of your practice? Is this within the scope of your job?" Creating boundaries on the role and communicating those boundaries to the relevant partners, like those referral sources I mentioned a few slides ago, can guard against the navigator role experiencing mission drift. The second area for growth was increasing the number of navigators. Navigators are often tasked with demanding caseloads that can limit the ability of time they spend helping any one person. Speaking about this concern, one judge stated that they wanted sufficient staffing to make sure that people aren't in danger of the burnout phenomenon. The people we spoke with regularly talked about expanding the number of navigators in the future to keep up with the increasing workload. Additionally, respondents spoke about expanding navigator programs to cover new areas of the courthouse. Some navigator programs, such as the navigators in Columbus Housing Court, are located in specific areas of the courthouse. As we mentioned earlier, courthouses can be confusing, and several people who work in courthouse described wanting to expand navigator programs to different areas, specifically targeting locations where people might need additional assistance, such as in family court. Now I'm going to throw things back to Sam to talk about benefits of the programs.
Thanks, Brandon. So the last topic area that came up in our interviews that everyone we spoke with had strong feelings about were the benefits of having a court navigator in their courthouse or working kind of in their legal system. All the benefits that people discussed fell into three kind of major themes. The first was that navigators benefit court and jail actors by reducing their workload and just generally providing them with support. Navigators take on a lot of the work that court and jail actors were doing that was really kind of beyond the scope of their roles, or maybe was kind of within their scope, but was hard for them because it was outside of their training. So a lot of the work of answering questions, directing people around the courthouse, sitting with people who are anxious, finding resources to meet people's needs. These are all things that when there's a navigator in place, clerks and attorneys and bailiffs and jail nurses can now refer people to the navigator rather than trying to do some of those things themselves. And they can know that the person is going to get the help that they need from the navigator. Navigators also really are a resource to court and jail actors. Navigators can help these court and jail actors get connected to service providers when they need information from providers about a person. And navigators can provide them with information on behavioral health factors that they might not be aware of, that they might not know to be looking for, that could really change how they address a case. So these two quotes really kind of illustrate this first benefit. For this first quote here, one court actor shared with us that submitting to mental health evaluations, submitting to substance use evaluations, complying with certain treatment recommendations, that's been the bulk of what our navigator has provided tremendous assistance with. Because before we had the navigator, a lot of what my probation officers struggled with is maintaining that connection between probation and the community treatment providers. So this person told us that POs lost a lot of time trying to get into contact with service providers to figure out whether people had gotten evaluations or treatment that they needed as part of usually court orders. And this is likely because POs don't have the time to maintain the kind of networks that navigators maintain. And this could really hinder POs' ability to make sure that people had followed through with court orders. And now this is a place where navigators can really kind of step in and help make sure that information is communicated back and forth effectively. And then there was an attorney that told us, I have a lot of clients that struggle with different diagnoses, bipolar, schizophrenia, substance abuse disorder. And what I particularly utilize the navigator for is just finding out my client's background. I've even had him go to the jail and do evaluations on people. A lot of times, if you don't have that training, you can't recognize what you're seeing. So this attorney felt it was really an asset to be able to work with the navigator to better understand her client's behavioral health needs and then incorporate that information into how she handled their cases. Another theme related to benefits was that navigators really aid people who are involved in the legal system. So my colleague Iceland really described this benefit well as she talked about all of the different kinds of needs that navigators can meet. But we heard again and again that navigators are really seen as friendly faces in the courthouse. They're very approachable. It's so helpful that they provide people with directions and information about the courthouse, about their upcoming hearings. They can really ease people's concerns or anxiety about their court involvement or their legal system involvement. Some of the navigators provide direct therapeutic intervention like de-escalation or crisis management or even some brief counseling sessions. And then, of course, they connect people to resources in the courthouse and in the community. And so these are two quotes from people who got services from the navigators, really describing how they benefited from these services. One person shared, our interaction was comforting because I was already stressed and anxiety high, but the navigator let me know what I needed to do. And then this other person really articulated the big difference that she felt like the navigator's help made in her life, telling us that it wasn't even just about getting me into a sober house. I was there for almost 2 years. And then now, for the first time in my life, I have my own apartment. I have a career that I'm working on. None of that was attainable or imaginable to me 2.5 years ago. So she really felt like the navigator's help opened up a lot of opportunities for her that she didn't necessarily know she would have been able to access otherwise. And she described the navigator's help as really kind of setting her on a path to success. The last benefit that we heard a lot about is that navigators bridge the gap between the legal and the behavioral health systems, which is exactly what this role is designed to do. So for legal system actors, facilitators, navigators really facilitate communication between these actors and service providers. They help these parties contact each other, like I already kind of mentioned a couple slides ago. And navigators also do a lot to help these parties understand each other's professional jargon. So sometimes courts send communications to service providers that service providers don't understand because there's a lot of legal language in the communication. And then vice versa. Sometimes service providers will send communications to the court that the courts don't always understand because of the treatment language that's included in them. So navigators, this is a way that navigators can really kind of step in and help ease some of that communication. And then for people who are involved in the system, navigators really facilitate connections to resources. They can help people access resources, help them get to appointments, help make appointments, and then help them get to appointments with service providers, which is a huge benefit. So this first quote really illustrates this kind of language divide that sometimes occurs between courts and service providers. So a service provider told us sometimes judges will write in an order what they want the person to do, not realizing that the person needs to be assessed for and qualify for that treatment. So a judge saying that a person needs XYZ doesn't mean that they meet the criteria for XYZ. And a judge in this same jurisdiction shared with us, that he was aware that this miscommunication was happening because he'd write a court order for someone to engage in a particular kind of service, and then the person would come back and say that they couldn't get that service. So the judge and the service provider kind of knew that this miscommunication was happening. And it was really the navigator who was able to step in and kind of work with the judge and talk to the judge about how he could write the orders in a way that was a little more clear for the service providers. And then the navigator could also be a resource to the service provider. So they could call him and say, hey, someone came in with a court order saying this or that. What exactly does this mean? And then the navigator could help kind of explain what the judge is looking for. So he's been a huge part of reducing some of that miscommunication. And we heard this scenario that it plays out in a lot of courthouses where sometimes it can be hard for the courts and service providers to talk to each other, and navigators can really kind of come in and help almost kind of translate between systems. And then the second quote was from a service provider who referred someone to a navigator this person was about to be released from jail, and they needed to be able to go straight to a treatment facility to comply with a court order. And so he said, I called the navigator and I said, look, here's the situation. What can we do? And I mean, I don't think a whole hour went by before she's like, all right, I've talked to the sheriff, the judge, the DA, the facility, the person that oversees the facility, and the parents, and this is what we've got lined up. So because the navigators are in this position where they really know all of the system actors, they know all the service providers, they can really be kind of a go-between for all of these parties, and can really, in some cases, facilitate very quick, efficient communications because they know how to talk to everyone. They know kind of what everyone needs to hear. And they can get access to services for people lined up really quickly. And that speed can be a huge part of getting someone from the jail or the court to services before they have kind of a chance to get lost in the shuffle. So as you all have kind of seen over the last 40 or so minutes that we've been sharing some of our findings, there are a lot of different models for providing court navigation services. There are a lot of ways to do this. And all of these models really aim to improve people's experiences with the court, to connect people to services, to answer people's questions, and to reduce future involvement in the legal system. We spoke to, like I said, 93 people in the course of this project, and 93 people told us that the work the navigators are doing is helpful, and that it is necessary work. Nearly everyone explicitly told us that they would recommend implementing a court navigator to any jurisdiction that's considering it, that they couldn't imagine going back to how they did things before they had the navigator. The role has just really been incredibly well received in the jurisdictions that have them. And so we just kind of have this last quote of a person who had gotten services from a navigator that really kind of captured the sentiment that is shared by so many people. This person said, I couldn't tell you how much I appreciate the work that the navigator has done. Like I said, she went over and beyond what her job title is. She really did. Every state ought to have court navigators. And so this kind of wraps up the portion of today's webinar where we talk about some of our findings and some of what we learned over the 3 years that we were doing this work. But I did want to share, we have a couple of resources that folks can access. We have an article in the National Center for State Courts Trends in State Court publication, and we have a podcast episode that we released earlier this year. Both of these just describe some more information about the different models of court navigation and the benefits of implementing a navigator. So we'll drop links for these resources in the chat. And we also have developed a resource guide that includes some really detailed information on the 5 navigator programs that we visited. This guide has way more detail than we could cover today, and it goes through each of the 5 programs and kind of specifically talks about these different topic areas for each program. So you can really get a sense of how these different models of court navigation work. And this guide will be publicly available at the beginning of next week. So when we send out the recording for this webinar, we'll send out a link for the guide as well that y'all can access. And we really just hope that these resources provide helpful information for jurisdictions that are either considering implementing a navigator, or for those that have one and maybe want to see kind of how other people do this role. And with that, I will hand things back over to Alon.
Thank you, Sam. So we have come to the next segment of our webinar today, which is a panel discussion with 3 court navigators. So they will share their experiences in their roles and advice for other jurisdictions considering implementing a court navigator or court navigation program. And so Dr. Samantha Zatola will moderate our panel, and she will be joined by Danny Turjan Whittemore, and criminal justice liaison who covers 4 counties in Tennessee, Luther Archer, who's a court clinician in Chesterfield County, Virginia, in the General District Court, and Nick Bolette, a court navigator in Buncombe County Court in North Carolina.
Thanks, Alon. I'm so grateful, Luther and Nick and Danny, for y'all giving us some time today and joining us, and really looking forward to hearing you all now get a chance to share some of your thoughts. So I'm just going to jump right into our first question to give y'all the most time to talk. So I was wondering, just to start out, if y'all could describe kind of as best you can, like a typical day or a typical week in your role, the different things that you're doing. And I'll just let whoever wants to jump in first.
I guess I'll go first since I was the first name listed. So a typical day that could be going into one of my jails. I get resources from anyone inside the jail and outside the jail for an inmate that is incarcerated that needs resources. I can go into the jail, pull them from the back, talk about the resources. I may also go to court and see if anybody is on possibility going to be getting furloughed, then get the resource to them to get the furlough approved. I go to all the recovery meetings here that are offered. I'm part of the recovery court team. I am part of other organizations throughout 2 of my major counties to try to make sure that I'm known that there is the resource here for them if they have someone that is incarcerated that needs the help.
That's great. Thank you.
So what I do typically during the week is I take the criminal dockets and research the different cases to see if I can locate people who have had contact with our behavioral health system. And that's how I start to build the caseload for the cases that I may attend. So I attend court. I also talk to defendants. I talk to the Commonwealth's attorneys. I talk to the judges. I also get involved with the families of the defendants. And here lately, we've sort of switched from that being the primary referral system for me to actually get cases to actually getting the judges directly involved. And we did that by creating a court clinician referral form that gave the judges a little bit of freedom to be able to sort of pass along a concern that they may see at the bench, and to allow my position or the court clinician to actually research any mental health possibilities from there on.
Do we still have Nick on the call? We might have lost him.
Hi
I know
there.
he's
Sorry.
Oh, are you here? Good.
Sorry. Yeah, with the storm and everything, Wi-Fi went down, but I'm back here. Would you mind repeating what the question was or the prompt?
Yeah. The first question is just if you could kind of describe a typical day or week in your role, just the different work and activities that you're doing.
Yeah. So my day kind of starts off. I try to arrive into the courthouse um, at around 7:45 a.m., about 15 minutes before we open at 8. And the idea there is to just get set up, make sure all the monitors that have directories in our criminal court calendar are up and running functionally. And then I set up like 3 key tabs within my computer. The first tab is the Court Navigator engagement one. So we track every single engagement we have with courthouse visitors. The second one is the Buncombe County Court Reminder System. And the third one is the North Carolina eCourts hearing search site. So I can confirm people's like the status of their case, their court location, and their date. And then once the courthouse opens from 8 to around 10:30, that's going to be our peak activity when people are coming in. And so I assist visitors, helping them find out where and when they have to go for their court date, directing folks to various places. This could be a jury assembly room, the cashier's, our sheriff's department, the clerk of superior courts, DA's office, could be our public defenders, Justice Resource Center. We have an intake office for restraining orders, civil magistrate, criminal magistrate. So it's really important that wayfinding is kind of an integral part of this because we have 2 parts of our courthouse, a new building and an old building. And then we have 3 different sets of elevator with very scarce. Then I'm able to escort folks as needed. Once you enter the courthouse, the information kiosk I operate is directly to your right after you pass security. And so if we're talking and I notice any kind of signs of distress or anxiousness, then I'm able to escort people to a specific location. This is especially the case with Spanish speakers. So I'm bilingual. So if there's a lot of Spanish speakers, already the legal jargon is a big of a headache, even if you're a native English speaker. So if I escort them, I'm then able to confirm that they made it to the right place, and then I return to the kiosk. Typically, other than wayfinding and interpretation, I also promote our county's court reminder system. So it sends text message reminders for criminal court dates in Buncombe County here in North Carolina. So I promote this service and I can even help people enroll directly. And this tends to be the case because there's a lot of visitors that are coming from more rural areas or backgrounds, and they're very unfamiliar with the community. So then after around 10:30, when there's a lull in visitors, and then I return back to my cubicle and I begin working on kind of adjacent tasks. Samantha introduced the community engagement work group and committee that I'm a part of. And that's a mix of different justice system court and partners, community service providers, and just county partners. And we work to really capture public opinion about related issues in the criminal justice system so that then we can devise ways to address them. My role actually emerged as a product of this work group because people wanted like a non-law enforcement entity to be able to help people in the court. So then after lunch, I return at 1:30 and courts are back open in session after lunch at 2 p.m. And all of this continues. We then have a really busy week known as administrative week. So during that week, we hear all of the traffic infractions and cases. So the amount of people we're dealing with on a day-to-day increases by like 500%. It's a lot. And then other weeks, I just have trainings offsite with my employer, Goodwill. So then I just make sure to communicate with partners to let them know I'm not going to be there.
Great. Thank you so much. Thank you all. I think it's really great to kind of see some of the differences in what your kind of typical schedules can look like. For the next question, can y'all talk a little bit about your goals in providing services to people, kind of what you're hoping people will get out of working with you?
become an
So,
active person.
I'm sorry, go ahead.
I always tell them when I meet them, my job is to help them become an active person in society, to be able to be support themselves, to support their family members, to be mentally stable, to get back the life that they've always wanted to have, not incarcerated. So we usually set goals and work on the first goal to then meet the second goal. So the first goal is usually to be not in jail, so sober living or some type of recovery process. Even, meetings, AA meetings, NA meetings, the drug coalitions, giving them those resources. And then a lot of times it's getting their family backs, working with the DCS workers, just trying to get them where they want to be.
For me, I sort of try and keep it very, very simple. And my goal is to service the undertreated defendant. So a lot of times we'll find that people just have not been exposed to mental health or substance treatment. And I keep that as the foundation of my mission, which is when I do interact with the defendants or get referred a particular client, my goal simply is to get them the treatment or the help that they actually may need in order to, um, better their situation and stay out of situations that I met them for in the first place.
And in my case, first and foremost, the number one goal is to provide this kind of empathetic, human-centered approach to customer service. The idea is to really disrupt that stereotype of the courthouse being this cold and clinical place by having somebody warm and with a friendly face that's approachable. And the idea is to be able to assist people not just with wayfinding, with interpretation, but it's important that we're not duplicating services. I'm in Buncombe County, we're what's called resource rich. So we have a lot of different existing resources. And I'm like this bridge that links people to what people are already doing, either in the courthouse or in the community. And then promoting our court reminder system is another big goal. The idea there is that we're trying to reduce the FPAs or the failures to appear in court, especially for something totally avoidable, such as forgetting or not knowing or misinterpreting your time. So we devised this reminder system that you can get in English, Spanish, or Russian, the 3 primary languages in our area. And then I connect folks to different community resources. We have flyers there. So whether that's the public health department for child support and social services, so a big goal is community resources. And then just facilitating like problem solving. Sometimes people just come to you with a problem. They have no idea where they're headed or what they have to do. So listening to them, even in my kind of more light touch model, it's important to really give an ear to what people are saying, because then it can lead to like solving larger issues. For example, somebody was talking about an accessibility issue with benches in the courthouse. So we didn't have exit benches by the exit. So you can like put your kids' shoes on or sit down. So then we were able to address that and get that need met. And then it's just a matter of a more human service. Like we put lollipops at the desk there so that kids or adults like this friendly gesture, tissues for visitors who might be crying. I have a roll of like paper towels under my kiosk. One time I had a visitor who was pregnant, had morning sickness, and she had unfortunately vomited on herself and like other parts of the courthouse. So I was able to just, give her a lot of paper towels to deal with that. Knowledge of like parking rates and change for people, masks, maps of the surrounding area. And that's really a big part.
Yeah, I think that's right. Thank you all so much. I think one commonality I hear across the goals is that it's so much about just kind of meeting a person where they're at and really seeing what they need and then kind of meeting that need in the moment. I'd love to hear you talk about what kind of support do you need from either court staff or jail staff or the service providers that you refer people to be successful in the work that you're doing.
So I'll go first again. So I have a very good connection with my nurse at a lot of my jails. They see them pretty much first after they if I go into a jail, of course, the arresting officer sees them first, but the nurse is usually one of the first people that see them. So if they come in with a mental health crisis, the nurse is going to know right away. And so I have a really good connection with pretty much every nurse at any of my jails that I go to. And then I also have a really good connection with our misdemeanor judge. He is very willing to help anyone with any substance abuse issue. He tries to give them a chance to better themselves. The DAs, they're always just an email away if they have any questions or have any questions or concerns. And then the clerk's office. I mean, you wouldn't think how often you need someone in the clerk's office, but you really have to have a good connection with the people who work inside the clerk's office to get you on the docket, to get you back in front of the judge, to know what's going to be on the docket, to see when the docket gets changed. There's so many things that happen on a daily in the clerk's office. So really having a good relationship with them. Law enforcement, I do part of the CIT training. I don't know if other counties offer that, but I actually go to the CIT trainings here in 2 of our counties. And so I try to represent myself and they know who I am. They take my phone number. I've actually been on a call. They've called me out and like, we can't get through to her mental health wise. I've been a case manager for mental health for many years. So how can we just have a good relationship on how to address certain things, police departments, hospitals, and then your local mental health facilities also that, you're sending a lot of these inmates out to get further treatment if needed, IOP, medication management, therapy, case management. If you have a good relationship with your mental health providers that are in your community will also help you out a lot. Sober living homes, I mean, like the administrators that do the intakes for the sober living homes. I know a lot of them on first name basis, the ones you use that are more frequent. You can just send them a text message and say, hey, I need to set up an interview. And they're usually pretty good about getting you in because they know the role that you play in these guys' life. So it's a close-knit community of a lot of people, but it all works really well with the criminal justice liaison role. And you kind of piggyback off of each other. And at one of my jails, we have a male and a female that do MRT classes and broken princesses, which are classes inside the jail to help inmates get on a better track and get rid of some of the trauma that they have had in the past. And so I work really closely with them because once they complete those programs, they may be ready to go into a sober living type situation. So we work really well together, and it's just, like I said, a close-knit community of a lot of people that want to help a lot of people get on the right track. So.
So I have close relationships with a lot of different departments, starting with the Public Defender's Office. I work closely with the Commonwealth Attorney's Office, so they're the prosecutors. I depend heavily on the General District and the Circuit Court clerks. They provide support with case documentations. So we here in Chesterfield, we have a public defender's office, and we still retain court-appointed lawyers. So from the very beginning of me starting, I tried to establish really good, warm relationships with the defense attorneys who are commonly practicing in the general district and circuit courts. My relationships with community corrections, which are like the probation officers and the pretrial probation officers, that's really, really important. And then there, of course, the judges. The judges need to be able to have some faith in the position to know that if they are assigning a defendant to work with the court clinician's office, that their orders are going to be carried through. So there's a lot of different relationships that have to be established and maintained in order to actually support the defendants that we're helping.
Nick looks like he might be frozen. He's in Asheville, so I know he's kind of in the heart of some of the storm that's coming through. Yeah, maybe it sounds like he's okay. So maybe we'll give him a chance to answer if he's able to come back on during the Q&A session. Thank you, Luther and Danny, for kind of describing the relationships and just the importance of all of the relationships that y'all have to maintain, and kind of talking about, Luther, I remember you talking about having like a champion for the role, like judges buy-in is such a huge piece of success in the navigator position. So I think that's really great to hear. I'm gonna end the panel for now. That's kind of all the time we have for now, but I really appreciate the three of you answering some of these questions and joining us today, giving us these really great insights. I think it's really helpful to hear you guys speak directly about the role and what makes it work well. And I know y'all will stick around if you're able to for the Q&A session. So for those watching the webinar today, if you have questions that you want to specifically address to Luther or Danny or Nick, if he's able to join back on, please feel free to do that, and they can kind of speak up during the Q&A as well. I will hand it back over to Alon now to introduce our last speaker.
Thank you. And yes, just as a reminder, I see some of you are putting questions in the Q&A pod. And so we are keeping track of all the questions so that we can get to as many of those as possible right after we hear from our next speaker. And so next we will hear from Michelle White, who is a senior program advisor at the State Justice Institute and the program manager for this project. Michelle has been a huge supporter of Court Navigators and was the impetus for this project. Her guidance and input throughout the 3 years that we did this work were incredibly valuable. And we're excited for her to close out our webinar with some thoughts and reflections on the value of Court Navigators. Michelle.
Well, thank you so much. It's easy to be a cheerleader for something that is so amazing. I will say I think Court Navigators are great, and they come in obviously so many different forms. So thank you all for the opportunity for allowing me to speak with you all just briefly. I do want to talk a little bit about the State Justice Institute, but I also really want to highlight a number of funding opportunities, because I know quickly after someone is sold on an idea that not only do they think, how am I going to do this? Which I can see by some of the questions in the chat, but then quickly after that, you get to the question of, how am I going to pay for this? So I want to address some of those questions, and then I'm going to put some links in the chat to give you some more information. And then at the end, I will also give you my email address so you can reach out to me directly as well. So I want to start with State Justice Institute. Who or what is that? The State Justice Institute, we're celebrating our 40th anniversary this year, was created by Congress 40 years ago to award grants to improve the quality of justice in state courts, foster innovative, efficient solutions to common issues faced by all courts. And as was highlighted earlier, the issue of not only navigating the courthouse, but the legal process, but also the process to be connected to recovery supports and treatment are interwoven and complicated. And so we are really excited to not only support this work, but also some of the projects along the way that have been mentioned and some that we highlight on our website. So we're gonna continue to support some of the projects that we currently are, and all those court navigation practices, whether it's through self-help centers, non-lawyer legal navigation, or as we focused on today, behavioral health navigators. So I'm gonna quickly drop into the chat. If you are interested in any of the grant opportunities from SJI, this is our website. And I'm also more than happy to answer any questions y'all might have today during the webinar, or unlike a lot of other federal agencies, it's perfectly appropriate to reach directly out to us and ask us questions before you apply for a grant to see if it's something that is eligible for funding and or if you are an eligible entity. So I strongly encourage folks to do that. So speaking of other federal funding entities, for the past 3 years, I have also had the fortune to spend half of my time on a detail at the Bureau of Justice Assistance at the Department of Justice. So I'm going to switch hats for just a few moments and talk about some of the funding and also training and technical assistance that is available from BJA, and I will drop probably more links than you ever want into the chat as we go, but feel free to also reach out to me at any point and I can reshare and or discuss any of those opportunities with you. So first, I want to talk a little bit about grant funding. So there are 2 types of grant funding that we typically have at BJA. One is formula grant funding that comes to the states and then is dispersed out to localities. There are currently 2 kinds that fit nicely around court navigation. You may have heard of at least one of them, the Edward Burr Memorial Justice Assistance, or JAG grants. And the other one is a fairly new formula funding opportunity, the State Crisis Intervention Program, where there are significant investments for courts and supporting their response to people in crisis. So I'm going to share those links with you shortly. Then there are the discretionary, or more commonly known as the competitive. So you apply directly to BJA when a solicitation is released, and you can request funding to implement things such as court navigators. So the program I'm the most familiar with is the Comprehensive Opioid Stimulant and Substance Use Program. You heard a couple of examples of projects that were funded under COSUP earlier in the presentation. And one of the most comprehensive, I think, that we have funded under COSUP is in Massachusetts through the Administrative Office of the Trial Courts in Massachusetts, where they've implemented navigators across the state, and they are highlighted also in the compendium report that was discussed today. Another grant program is the Justice and Mental Health Collaboration Program, or JMHCP. This grant opportunity really focuses on mental health and co-occurring. So navigators certainly make sense there. And then what folks are most familiar with in the court world around behavioral health are, of course, all of the treatment courts. So adult veterans community court, tribal healing to wellness court, that very substantial grant program at BJA. And then finally, the last thing I wanted to highlight in terms of support from BJA is training and technical assistance. And we kind of use those terms as if everybody knows exactly what we're talking about. So training part is pretty easy, but technical assistance can mean anything from where's the link to that compendium that I heard all about? Where does that live? Can somebody please tell me? If I can't Google it, though I could tell you, you can, and you will find it, and it is great. Or I need a speaker for something, or I need to talk to somebody about this, or could you link me with someone who's doing this work? All of that is technical assistance, and by and large, it is free. And you do not have to be a grantee to access that support. PRA is a training and technical assistance provider for many, many awesome federally funded grant programs. So they are a really great entity to reach out to as well. So I'm going to put a couple of links to websites related to COSUP and JMHCP, and also the State Crisis Intervention Program, where you can ask for resources or training and technical assistance. If you want information that you have heard about today in terms of the compendium and the ongoing studies, PRA are your people. That's who you need to reach out to. They can connect you to all the other folks that are doing this work as well. And then more broadly, I just wanted to share with you that BJA and SJI are both great resources for finding out about federal funding opportunities. And so connecting with them and following them on social media is also a really, really great idea. And then I promised to put my email in the chat if you have questions about SJI or what I talked about BJA. I'm more than happy to respond to either. And after I'm done talking, I'll put the links to those other training and technical assistance resources. But I really just wanted to conclude with a couple of thoughts. First, a big thank you to PRA for when I reached out and said, this Court Navigator thing, it's super cool. We need to learn more about it. They quickly said, yes, please, how can we do that? So a big thank you for that, because it has been already hugely, I think, impactful to the field in really understanding when you say court navigation, what can that look like? Because at least in the beginning, it was very much confused with non-lawyer legal navigation. And so we really want to make sure that prominently out there in the universe is a lot of great information about behavioral health related navigation. So a big thank you to them. And then I will say also a thank you to all of you who have joined today to learn more. I don't know where you're all sitting right now, but if you're interested in a court navigation program and you have friends in the courts, or you are the courts, or you're the behavioral health provider and want to go make friends, it is possible, as you heard, to really start small, but then form a really great relationship and make things happen. I've been in a lot of courthouses in my career, and navigation does not always happen. It doesn't always happen through the courthouse, through the legal system, or connecting folks that need behavioral health assistance. This is a really promising way to be able to do that. So I hope if even you're a little bit curious that you will reach out to learn more. So thank you again, and I will turn things back over to Alon.
Thank you so much, Michelle. And if you all will see in the chat, there's a lot of links and resources. And so hopefully you all can copy and paste those and use them as needed. And now we do have time for our question and answer. We have had several great questions come up from the audience. You've seen some of them in the chat, but also some in the Q&A pod. So if you have any additional questions while we're talking, please feel free to put them there as well. And just as a reminder, the link for this webinar will be sent out to everyone who's registered. And so if you miss some of these things, you'll be able to catch them again in the replay. And so one question that came up is, it was a couple questions around some of the logistics. And so one question was, who hires and supervises the navigators? And I know that can vary a lot depending on the program.
So I work directly under Volunteer Behavioral Health in Middle Tennessee. I am grant funded through Volunteer Behavioral Health in the state. So my supervisor is Nathan Miller, and Shirley Jennings. Shirley is over one of the local centers, mental health centers that we have, and then Nathan is over more people. So I have supervision with both of them. At least every other week to go over cases if I have questions or something like that. But those are I'm through Volunteer Behavioral Health.
I have a similar setup. I have a clinical manager who is with our local behavioral health authority. And then I have a supervisor or manager who has a legal background, actually an ex-lawyer who practiced law as a Commonwealth attorney. And so we don't meet as frequently as when I first started the position, but generally about once a month. And I have the ability to go get any concerns that I have about clinical matters that I may not be able to handle myself. And then I also have somebody who has the legal expertise to help as well.
I'll just chime in and say, kind of from the broad perspective of what we saw, what Danny and Luther described is pretty common. The funding a lot of times will come from kind of grant or sometimes, county or city government funding, but then it is kind of routed through a nonprofit or a behavioral health agency, and that will be who actually hires the navigator. So they're employed by behavioral health or a nonprofit, like Nick is employed by Goodwill. So then we'll have a supervisor through the behavioral health agency or the nonprofit, but then they're stationed in the courthouse full time. And a lot of times they'll have a supervisor through the legal system as well. So that's a pretty common setup that we saw for navigators. So it's kind of co-supervision, and the hiring I think that varies a bit. Sometimes the hiring is a joint decision between the court supervisor and the behavioral health or nonprofit supervisor. Sometimes it's just the behavioral health or the nonprofit agency that does all the hiring. That varies a bit.
Thank you all. Another question that has come up is about caseload. And so what does the average caseload look like for navigators?
I think this is another one that varies a lot. It really kind of depends on how involved the navigator is with someone. Some of the navigators are real light touch. So like Nick will just kind of greet people as they come through the door, and he's not really taking anyone on as a caseload. Luther and Danny, I don't know if you guys want to jump in. I know you spend a little bit more time with the folks that you work with.
So it really varies by area and by jail size. So I serve 4 jails, and Macon and Smith are my 2 bigger jails. And like this week, I've probably seen 5 to 10 in those jails, and those could be follow-ups, those could be new, those could be quick resources. Some of those, may take an hour, some of those may take 10 minutes. And then in my smaller jails, I may see 1 to 2 in each of those, just depending on the need. Now in my smallest jail, I may not have anybody in my smallest jail for 2 weeks. But my larger jails, I can pretty much say that I'm going to see follow-ups, new, quick resources, court appearances, those types of things, about 10 a week. Now my whole caseload, I have no idea what that number is. I know we have a goal that we have to meet once a year, but like going back and seeing how many people I've seen since I've been doing this position, I have no idea what that number would be. But overall, I would say you see about 10, I'm going to say 10 to 12 a week vary. And that doesn't sound like a lot, but when you're trying to get them to sober living and you do 5 applications and you're set them up with mental health treatment and you have some in recovery court and you're going to court and it actually is a lot when you sit down and you have to meet all of their needs.
I sort of laughed at when Danny, said that, because it's hard to sort of put a number on it. Since I've been working here and it's been 3 years, I would say probably a total of 150 cases that I've handled. And on any given week, if I had to put a number to it, I would say probably 7 to 8 that I'm actively interacting with. However, I'm hoping to make sure that everybody understands that a lot of the work that I do involves actually going into the courtroom and sitting through cases. And so that takes up a lot of the time. And then there's sort of a uniqueness to how we actually I actually interact with the defendant. So it wouldn't be as if I'm in my role as a licensed professional counselor where we're actually having scheduled sessions. So the interaction is more of a ebb and flow of how you actually see defendants and work with them and their families. So it's sort of hard to put an exact number on it and get exact statistics about it, but it's around that number.
Kind of related, since both of you all mentioned tracking, right? How difficult it could be to keep track of how many folks you all see. Someone did ask a question about that. So, and perhaps Sam and the research team, you all might talk about how it might look across all the varying programs. but how is data tracked to know the number of people you've assisted and the final outcomes?
So we have a system that we have to input in. We use 10 WITs here in Tennessee. So we use a 10 WITs program, and that's where we have to input all the inmates that we help with any type of resource and prolonged services that we provide. And then if they get released into a mental health facility, of course, they use another program. It's CareLogic for volunteer. So that also gets tracked if they've had services through the criminal justice liaison through volunteer, kind of like a double header there. So that's kind of how we track through volunteer. But 10 WITs is what I use to, and then I have my own spreadsheet just because I don't want to miss somebody because, you know, you never know. So I have my own spreadsheet and I list everybody's name and list the date that I've actually seen them and, you know, those types of things just to be a little more organized. Because I've recently just got on the box for all the inmates, and I don't know, that's amazing. That needs to be added to everybody because I love being on the box. It's so much easier. But it just makes it easy. Like they send me a message, they want to be seen. So I add them to my spreadsheet and say that they reached out. And then I put when my initial visit was, you know, when I submitted an application. If I noticed that I haven't got an email back from them or a call back saying that they, you know, have an appointment for an intake or something like that, I can follow up with them and say, hey, did you get something inside the jail? If not, then we need to do more applications because you wasn't accepted. So I kind of have that program in my head to stay a little more organized because you can get overwhelmed with all the things that come in with the inmates.
Thanks, Danny. I think that's kind of a great example. And what we learned is that data tracking is different at every program. Everyone's kind of doing things a little differently. So sometimes, like Danny mentioned, there's the kind of 10 WITs, which is kind of happening across the navigators, and they're all feeding into it. So they have kind of a large database. Sometimes there's individual level tracking that they're doing. I know Nick fills out a form after every interaction that he has. So he's keeping track at least of the number of people that he's seeing and kind of generally tracking the type of service that he provided or, you know, what the interaction included. One of the programs, Project North, the Recovery Support Navigators in Massachusetts, they're partnered with an agency that's helping them do some data collection and evaluation. Some of the other programs, because they're very like locally implemented and you know, kind of put in to meet needs as they're happening, there's not always a huge data tracking infrastructure that goes in at the same time as the program. So sometimes the navigators are kind of keeping their own notes and tracking things, but are not necessarily feeding into kind of a larger database. So I will say from the research perspective, this is something that we would really love to be involved in one day as kind of a next step, is to do some data collection and tracking and kind of look at outcomes for the navigators, because that's not something that's been done, at least that we've seen, on kind of a large scale yet.
Yeah, and I'd like to reiterate that that was probably one of the biggest deficits in the position is when it was created, I don't think a lot of thought went into how to track the data. That could have been because the position was just being defined as it was started. And so, you know, from my point of view, I've had to sort of do a makeshift type of tracking. But if people are considering bringing on a position like this, that should probably be considered in the formation of that position, how you're going to track that information, what kind of electronic health record tools you're actually going to give your court navigator.
Thank you all so much. We do have a few more questions, but it is 2:34, so we are officially over time for the webinar. This has been a phenomenal experience. I've appreciated learning so much more about court navigators and have been just over thrilled with how many of y'all have joined us today. Again, we will be sending out a link to all registered webinar participants with the recording, so you can share it and review it, and hopefully also take advantage and look at the resources Michelle has shared with us if you're interested in starting or expanding a similar program. Thank you to our guests today, to Danny, to Luther, to Nick, and to Michelle for joining us, and our presenters, Sam, Brandon, and Iselin, and for all the wonderful questions and discussion. Thank you all for your time and expertise.